last one recording. We don't ignore soft tissue.
G'day everyone, my name's Chris Showalter. I'm Program Director of MAPS, Maitland Australian Physiotherapy Seminars. Went to PT school after I first did a Bachelor of Science with Honours in Reproductive Physiology of Sheep. For those of you who are interested, my thesis was entitled, are you ready? You can't make this up. Studies on the effect of continuous testosterone administration upon serum luteinizing hormone levels in the chronically castrate male sheep. I decided that wasn't for me. It was fun. I got a PhD grant from Australian government out of it, but I decided not to pursue that, and I went to PT school. I did PT school at a place called Lincoln Institute of Health Sciences, which at the time in Melbourne, Australia was the only place you could do a PT degree. Graduated that, went into private practice with a good friend of mine, Chris Conway, good friend of mine still. With Chris's influence and his urging, I went and spent some time with Geoffrey Douglas Maitland, who is the founder of the Maitland Australian approach. Geoff passed away in 2010, very sad time. Geoff was practicing out of the University of South Australia in the graduate program in manipulative therapy. In fact, it was the first graduate program in manual therapy in the world. Geoff Maitland was a co-founder of iFont along with Gregory Grieve, Stanley Paris, and Freddie Carlton-Bourne. Geoff's patient-centric, empathetic clinical reasoning model is considered one of the worldwide standards of patient-centric care in orthopedic manual therapy. So what is the Maitland approach? The Maitland approach to patient management is an empathetic, patient-centered approach. Geoff's number one principle of patient management was a sublimation of self and to develop an empathetic understanding of what the patient was enduring and how it was affecting their life. That was number one, not number 14. Really important. Interview the patient in a narrative style and believe their story. Believe that what they're telling you is accurate and true. And that's true 99% of the time. Sometimes you get the people who come to PT because the attorney said, look, we got this lawsuit going on. You got to bang out a bunch of PT visits to show that you were injured. That's how we get ka-ching, ka-ching, the big bucks. Ignoring that, believe the patient, trust the patient, develop a relationship with the patient. Physical therapists will tell you, manual therapists or otherwise, we're some of the few clinicians who spend a lot of time with our patients. The average American physician interrupts his or her patient in the first 14 minutes. They don't allow the patient to tell their story. You know, a typical physician visit, let's say you injure your knee and you see the physician, your regular GP, primary care practitioner, PCP, and they say, yeah, you know, take some Aleve or some Advil, put some ice on it, rest, stay off it for a little while, see how it's going. They typically at that point don't refer out to professional rehab care like physical therapy. So what happens then? You come back, it's not better. They say, well, you got to go see an orthopedist. You go see the orthopedist says you need an MRI. You go back, you get the MRI, you come back and see the physician points to the MRI, tells you what's wrong with your knee and why you need surgery or whatever it is you need. No one anywhere along this continuum has asked you what's going on. How is it affecting your life? What are you able to do? What are your capabilities? What are your restrictions? What's limiting you? What can I do to help you? Geoff Maitland's first question to a patient, and something that I was trained in and many classically Maitland trained patients is, let's say the patient's name's Bob. Hey Bob, as far as you are concerned, what do you feel is your main problem? I had a patient years ago in Philadelphia and he said, they keep injecting my elbows for this elbow pain I have, but I have it on both sides. And I've found that when I do that with my neck, I get my elbow pain. I keep telling them, can you work on my neck? And they just keep injecting my elbows. Sure enough, he was a cervical patient. He had bilateral problems. So I used a central PA, which is useful for central and bilateral problems. And we cleared him right up. 3 visits. Do you understand the emphasis on that? It's about the patient. It's about what they feel is their main problem. Not what the MRI showed, not what another clinician told them, not what they read on the internet or Dr. Google. What do you think is your main problem?